I've made this argument before, but I'm going to argue it in terms of these two economics professors. I find it interesting that you can open the pages of the Washington Post, and you will see Rahm Emanuel make the argument Medicare for all is a pipe dream, without them disclosing that he's working in an investment bank. They may have clients that are absolutely and entirely against Medicare for all ever coming to fruition. You see this part. They don't show you and disclose this part. The truth is that Medicare for all is a massive tax cut for workers and the poor. Two economics professors from California, Berkeley, make that basic argument that, look, people are looking at this in somewhat of a wrong way. Medicare for all is the largest raise ever given in a generation, or the largest raise that people will see in their paychecks in a generation. And their argument on this is straightforward, essentially part of the argument that I've made. Your healthcare cost is a tax. It's a tax that you pay to a corporation as opposed to paying to a government. But it's a tax nonetheless. And it's a flat tax. Oftentimes we look at America's tax system as somewhat progressive, but in this particular case, it's not progressive at all, because for all intents and purposes, let's say if you were a secretary making $50,000 a year, pay roughly the same amount as your boss, who may be making 4 or 5 times that much, let alone the other people, owners of the company, and whatnot. The catch here is you can't get healthcare on the cheap. Healthcare is expensive, even bad healthcare, and let alone when you have to use it. You pay a tax to a corporation whose job is to maximize their profit. They take that tax and say, thank you, and then go about finding ways to deny healthcare in order to make themselves a profit. This is somewhat of a maddening process. Medicare for all, getting it across the board, gets rid of this regressive tax that each of us have to pay that we can't get away from, because ultimately Obama has said by law you're supposed to have healthcare, and not just by law you need to have healthcare. Just as a human being, if anything goes wrong, you need to have the ability to get yourself taken care of without necessarily going bankrupt doing it. Medicare for all gets rid of this regressive tax. And not just gets rid of this regressive tax, it allows those people who are paying that tax, meaning all of us, to take home larger sums of money on our paycheck because that tax is not being paid each month. Go back to the secretary example for a moment. Under Medicare for all system, that secretary wouldn't be paying that tax each month, nor would she be paying a tax if she had to go and get a procedure done or get a surgery done or got cancer or whatever else. Ultimately, that is money that she sees in her paycheck month to month to month. So instead of her making, let's say, $50,000 a year, she ends up bringing home $65,000. She still has to pay taxes, however. And in the paying those taxes, let's say she pays $4,000 for healthcare in regards to taxes. Well, beforehand, if she was paying $13,000 a year or some other sum, she is now lessen the amount that she is paying for healthcare. By the same token, her boss, somebody who's on a higher end of the income distribution scale, ends up paying more. In an odd way, or in an interesting way, you pay according to your means. And because you pay according to your means, if you make less, you pay less. As opposed to this flat tax that we end up paying by giving that money to a corporation. Meaning, by not allowing the brunt of that to hit the individual, and by adding that within the sense of a tax structure, you are allowed to have that to be somewhat of a progressive tax where people at the top pay more and people at the bottom pay less. If you're making $29,000, you don't pay anything at all. Which means that as you incrementally go up, yes, you may see your technical taxes from the standpoint of the government go up. But the amount of money that you've gotten in your paycheck from the standpoint of a raise, because Sanders has taken that particular tax to the corporation off of your back, you see an increase, a dramatic increase. And the overwhelming majority of Americans would see a dramatic increase in the amount of money that they bring home. It would effectively be a dramatic raise. You're still paying for healthcare. The only difference is you pay according to your means, and people at the higher end of the income distribution scale pay more. That's effectively the argument that they make. And that argument is dead on right. Think about it for the moment. What does it matter if it's a tax that you pay to a corporation versus paying to the government? Well, when you're paying it to the corporation, you still have to pay when you go to get an x-ray. You still have to pay when you go get a procedure done, when you get your medication, all that stuff. And you, as an individual, take the brunt of all of that. All of that goes away. All of that goes away. And instead of paying it in those terms, you say, I'm just going to pay it to the government. I'm still seeing my doctor. I'm still getting my procedures. The difference is I'm not paying at the point of sale. Meaning there's not a person who comes to my room when I get put into the hospital and I'm in massive amounts of pain, something that happens, and they try to get my insurance information while I am screaming on the bed with a nurse waiting to inject me with pain medication until this process takes place. That goes away. It's a tax that goes away. Or at the very least is lessened dramatically and paid to a different vendor. The vendor being the government. This argument, and I love it because it brings it home. You will get a pay raise by supporting Medicare for all. A tax that you were paying to a corporation would now get paid to the government, allowing that tax to be paid in a progressive way. Whatever you were paying for healthcare before, especially if you're part of the, let's say 90%, will go down. And you will see that end up in your wages. If you didn't have to pay for healthcare each month, I think I pay around $250, $260 for healthcare each month. Every time I go to the doctor, that's another, $20. Every time I get a drug, that's another, $20, $30, $40. And God forbid, I got to get a surgery or some other larger procedure. All of that are taxes. You can't get away from them. And your boss, a person who may be making $1 million, pays the exact same amount as you do. Medicare for All changes that dynamic to where you don't pay at the point of sale, and what you end up paying is your taxes. By the same token, those taxes are dramatically lessened, and the people at the top end of the income distribution scale pay more. I know I'm saying this and repeating this. I just want to nail this down that you will see a increase. It's a massive tax cut. For instance, Bernie Sanders' tax proposal would be enough to replace all existing private insurance while leaving 2.6. I'm going to leave this article at the bottom, but that gets a little dicey. Let me get to this part. Take again the secretary earning $50,000 in wages and currently contributing $15,000 through her employer to an insurance company. With universal health care, her wages would rise to $65,000, her full labor compensation, with an income tax of 6%, which, if applied to a base large enough, will be enough to fund universal health insurance. She would have to pay about $4,000 more in taxes. But the net gain will be enormous, $11,000. Instead of taking home $50,000, the secretary would take home $61,000. And again, understand why. She doesn't have to pay the health care each month. And because she doesn't have to pay the health care each month directly, that money just goes directly to her in wages. Yes, she has to pay $4,000 in taxes. By the same token, she saved $11,000, meaning she takes home $61,000 in wages, as opposed to before, where she was only bringing home the $50,000. Medicare for All is a massive tax cut. Don't let them tell you otherwise. Like, share, subscribe. Thanks all.